Hello, everyone. Thank you all so much for joining us today for this very important discussion. And I'm thrilled to be joined by three extraordinary women who are on the front lines of helping so many in our communities who are really facing unprecedented economic hardship because of this pandemic and are struggling to keep access to the nutrition they need. So I want to introduce my three guests. First is Carol Tienken with the Greater Boston Food Bank. We are also joined by Myriam Michel with Healthy Waltham, and Ava Millona with Massachusetts Immigrant and Refugee Advocacy Coalition. They are here with me to discuss the very important issue of food insecurity and hunger relief during this pandemic, as well as the communities in our state that are most in need. We are many months into this crisis now, and families across Massachusetts are experiencing extreme financial hardship, and some are turning to food banks for a lifeline. It is also clear that this pandemic has exposed and widened the holes in our safety net and worsened pre-existing inequities that disproportionately fall on immigrants, women, and communities of color. Right now, 1 in 7 people in Massachusetts is struggling with hunger. In Eastern Massachusetts alone, 1 out of every 6 children is now at risk for experiencing food insecurity. And thanks to the important work of Ava and the MIRA Coalition, we have learned that roughly 6 out of every 10 immigrant households in the Commonwealth may not be getting enough food to eat. These numbers are truly staggering. And I'd like to start our conversation by asking Carol and Myriam to talk about how their organizations have responded to this increase in demand and how you've adapted your work to our new socially distant guidelines.
So, Myriam, okay if I dive in?
Yeah, go ahead.
So the Greater Boston Food Bank, I mean, for everybody, this all sort of, we went over the cliff together, and we thought we were in pretty good shape with our inventory. We didn't have a handbook for pandemics. We did have one for disasters, but not for pandemics. But the demand started almost right away, and we've seen roughly in our distribution about a 59% increase in the last 5 months. Just to give you an idea, we've distributed 40 million meals so far against a backdrop of the same 24 million last year. So significantly more. The big key for us versus other food banks across the state is that we have, I can't underscore this enough, a remarkable network. We have 500 agencies in Eastern Massachusetts. We've been investing in these agencies for years to try and build their capacity. I want to tell you it's paying off. At the worst, at the beginning of April, we had about 10% of them closed, and we're back up to 97% open. And these people have been tireless. They've been doing drive-through distributions, touchless distributions. We continue to focus on nutrition. They continue to look at our inventory and order whatever product we have. Our staff is working twice as hard. We've sent 50% of our staff to work remotely, and the rest of us are here in the building just trying to keep our heads above water. But we couldn't do this without our partners, not at all.
Yeah, it is a partnership undertaking. Oh, yeah. Myriam, what can you tell us about how this has been and how you're adapting?
So definitely I have to say kudos to Greater Boston Food Bank. And it's through that partnership that allows us to serve the community and the other surrounding communities around us. And so with that, I would say, just to give you some perspective, before COVID, Healthy Waltham was holding once a month food pantries that would serve, we had 2 pantries, one that served the families in schools, and one that specifically serves seniors. So we would, between those two, we would be serving 400 families a month. And since April 1st, we have been serving 500 to 650 a week, excuse me. And we are now hosting, like I said, now weekly pantries. And we were underprepared since after the COVID on April 1st, we had our first pantry. We had about 330 servings and about 900 people showed up. So we weren't able to serve everyone that we had, but we made a commitment then and there to make sure we work with not only Greater Boston Food Bank, but also other food rescue organizations in Massachusetts, anywhere from Boston Area Gleaners, which is a food rescue organization in Waltham, to Food Link, Food for Free, Gaining Grounds, and even Waltham's local farm here, the Waltham family, the Waltham Fields Community Farm. So we have, the numbers are not going down, unfortunately. They've been steady, but they're not going down. At our peak, we were serving about 700 at one point, and right now we have averaged to 600. So it's a hefty work, but it's rewarding. The people that we serve and the people and the gratefulness that we see in their faces just allows us to keep doing this work.
Yeah, and it is one of these issues that has been certainly made worse by the pandemic, but was there before. What can you tell us, Myriam, and all my guests, I'd ask you to chime in about why you think, how did we get here? And why do you think that issues around food security have not taken a higher priority?
I'll chime in a little bit. So what people don't know about Waltham, we may be surrounded by other well-to-do communities. However, Waltham is a highly populated immigrant community. Its nickname is Kampala City because we have a high population of Ugandan immigrants, but we also have a high population of Central Americans and Haitians. And so people who have left their country to come here may not know the language. They're dealing with immigration status, housing status, and then food access is just a trifecta on top of that. And so they were already disadvantaged to begin with. And so all COVID did was bring what we were always doing in the background foreground, and has even exacerbated. So I think Eva can speak to that. These are problems that always existed, but now they're forefront.
Yeah.
Cannot agree more. Well, first, let me say, Congresswoman, thank you for hosting this discussion and the attention to this really crucial matter. And kudos to my colleagues, Carol and Myriam, for the amazing work that you do. And, as Myriam stated, I mean, these issues of inequity and disparities existed prior to COVID and have a long history, unfortunately, and it's a long list of causes for these insecurities. But, COVID was really a wake-up call from Massachusetts and, in other parts of the United States as well, that really highlighted the cracks that were already there and existed for a very long time. We knew how hard COVID hit immigrants' communities. We know that they start from a disadvantage point. If you look at the statistics, half of the non-citizens in our Commonwealth live below 250% of poverty line.
That was half is what you said.
Half of non-citizens, yes. And then more than a quarter live in below 125% of the poverty line. So they start at a disadvantage to begin with, and then the crisis added another layer of challenges. We knew that this was hard. We saw the state data as well, talking about how hard the Latino community and the communities of color were hit, but we didn't really have the hard data before the survey that MIRA and with our members conducted during the month of July. And I encourage you to go to our website, miracoalition.org, and download the community survey, Impact of COVID-19 pandemic on immigrants and refugees in Massachusetts, to see those hard and shocking numbers that really highlight the crisis. We did this survey in 15 languages to really find out in all communities, and we didn't reach all communities, but I think 15 languages was an enormous task to begin with. And we had about 433 responses from households across Massachusetts. And one thing that really I wanted to highlight is that as hard as this pandemic is on immigrant population, they are really resilient and courageous people, and very, very strong. 59.3% of respondents reported food insecurity.
Wow.
And or listed at least that they were able to use one source of cash assistance or a public program or a charity to survive. And we surveyed families with at least one non-citizen, at least one undocumented person, and the share for households with undocumented members were at 77.8%. And 2 in 5 respondents overall, and 3 in 5 in household with undocumented members reported, in addition to food shortage, also housing insecurity as well. And only 29.8% said that they had received federal stimulus payments, the $1,200 per taxpayers. But so many of them were left out because of the immigration status. And I'm talking about also citizens who filed jointly with ITIN holders that experienced that. So that added, the exclusion from the safety net really added another layer of difficulties for this population. So, the point is, these cracks in the system were very present before, but they are highlighted, and the complexities are another, added more into the mix. And in addition to inequities, also immigration policies and what's happening under the current administration, a whole transformation of immigration law and policy has made families really fearful to access food for their children. The very high publicized public charge, the wealth test, it's making families think twice to go and access food for their children or any other safety net available, or whatever they are eligible for, out of fear of losing status or not being able to get status. So Congresswoman, we rely on advocates and outstanding members of Congress like you to really address not just the short-term food insecurities, but really looking deep into the systemic causes of this, and really coming up and formulating laws and policies that really talk about inclusion and the well-being of everyone residing here.
Yeah, we have to do it. We know this problem existed before. I think our recovery is going to be a long and difficult one. So we need to really look at how we got here. What are the factors, and attack this on many different levels to make sure that all families, have enough to eat and to sustain themselves and be healthy. And, what you've described, Ava, in the immigrant communities, we've known this. We know these disparities that this pandemic has brought into stark relief. But for some people, with the unemployment rate at now the highest in the country in Massachusetts at nearly 18%, going to a food bank, going to a food pantry may be the first time that their family has had to do this. and maybe the first time that it is such a dire situation that families who have experienced unemployment are now turning for help. Can you walk us through, Carol, what that looks like? What is that process of going to a food bank or food pantry look like for families?
So I have, I'll do that in just a second. But I do want to throw out there as part of the end of that last conversation that we are lucky in Massachusetts in that this governor has started a food security task force under Secretary Theoretes and has put $56 million, which, you know, we could do with a whole lot more. But the fact that the Commonwealth is, in our opinion, finally looking at this with some gravitas is huge. And if we can sustain that, which I think we can, I think there is a recognition that the infrastructure here is fragile at best. And then to answer your question, I feel very strongly that if someone is in need of help, that the network of opportunity, you know, organizations like Myriam's will welcome people. They do not make this hard. They do not make it. What folks don't understand is you don't need to prove you're hungry. You don't need to walk in with a driver's license. You just need to go say, "Can you help me?" And actually, Rep. Clark, you and I had this conversation when the government shut down a year and a half ago, and the same thing. Suddenly, you had these people who never needed anything going onto websites where there were plenty of opportunities to find what was close to them and go ask for food. And it's not just you're lucky to have calories; it's good food. It's produce. It's a lot of the dry goods, just like everybody else. The emergency system suffered very badly early on with the supply chain and the supply chain drying up. The one thing that we did continue to have was produce, and we continued to bring a lot of produce in, and now it's sort of stabilizing. But the process is not a hard one. They identify themselves. Mostly these are drive-throughs now, so you don't even have to do much but get in the car line and follow the car in front of you, and somebody is going to appropriately distance themselves with masks on, et cetera, and ask you to open up your trunk. And they will put food in there. And it's not going to be enough for, the next 2 weeks, but there are other organizations, other pantries in their neighborhoods that they can go to continue to get help. And then the last part is food stamps. Food stamps, there, as you can imagine, the increase in food stamp applications has been huge. For us, it's been about 200%. It really needs to be more. It would, USDA, all of you guys did yeoman's work in getting more USDA programs, but we don't have the infrastructure in place and the administration in place to be able to do these quickly. So even though the CARES Act was passed quickly, for example, we didn't get product until almost July from USDA for those acts, and so you've got this waiting period. But programs like the pandemic EBT and SNAP, if we could just start to increase these, those infrastructures are already in place, and you can start to get help to people much faster than you can physically, and drive them into the retail and grocery stores.
Yeah. Myriam, what do you see for families who are coming to your organization?
Yeah, so it is people from all walks of life. So people who didn't even consider food pantry before are walking in. I can state two testimonies that we've personally received. One was from and senior housing, who a member from senior housing who stated that tears are flowing. She's never had fresh eggs in a couple of weeks, and she's just so grateful. From a family with two sisters living at home, and one lost their job due to COVID, And because of the pandemic, and what we're doing, she's able to provide for her family because she now depends on what we are providing as her groceries for the week. And Healthy Waltham has made it a priority, just like Carol was stating, to provide meals for families. So produce is very important. That's why we work with so many partners that we do. And of course, they'll get dried goods, but meats and so this is not that's the stigma that most people believe is when you walk into a pantry, it's canned goods or expired food items. No, these are fresh. You know, we've partnered with like 2 farms in the area. They are providing fresh produce, fresh greens, with a mixture of canned goods and meals, because we understand that camps are not open. School's not open, daycares are limited options. Some people still have to stay home because they can't go back to work. And so we want to make sure when a family comes to our pantry that if they're coming to the pantry, they need the help. So if people are standing in hours on end, you know, many of our pantries, we had people standing 4 or 5 hours ahead of time for the start of the pantry. If you're there, we're not going to make you even more insecure about coming to receive items. It shouldn't be that way. And so we definitely, one, for safety, we can't do registration, but we understand that food security is a humbling experience. And we don't want you to jump through hoops just to receive food. And so we see people from all walks of life, and Healthy Waltham can proudly say, we probably are one of the only pantries in and around the area that has a walk-through and drive-through due to the demographics of the people that we serve. Not everyone has a car. There's some people who've come on bikes, the people who have carried away their items in suitcases. So it's a come as you are and receive the foods, receive items that we can provide for you. And, you know, with this work since April, we could say that we have served over 5,000 families, serving 140 pounds of food with 22,000 bags of groceries. So when someone comes to our pantry, they're receiving 4 to 5 grocery bags of produce.
That is amazing. And, you know, part of what we celebrate and love about Waltham is this beautiful mosaic that it is. And it's just, you know, so heartening to know that you are responding in kind, that however you are, suitcase, car, bicycle, on foot, you know, you are welcome and you will get the food that you need. And so we are very, very grateful. And, you know, part of the work that I've been doing in the House is we passed the HEROES Act over 3 months ago now. And it included $150 million in funding for local food banks and a 15% increase in SNAP's maximum benefit through September of 2021. So I would like each of you to comment on how these federal security programs affect your work and help communities in need. And I can't help but draw also a bit of a contrast to the response that we have had from our Republican counterparts in the Senate to the HEROES Act. With SNAP benefits, we saw a response of $250,000 increase to address hunger nationwide. $250,000, but they were willing to put $500 million investment to make business lunches completely deductible on your taxes. And so in this time where you are really living and working our values and priorities, if you can talk to us about the importance of these federal programs to your local work and why we need to keep fighting for them. Maybe we'll start with you, Ava.
Sure. First of all, thank you for all your work on that, and very excited, you know, when the House passed the HEROES Act, and that's really inclusive, and it made a huge difference for our Massachusetts families. If you look at the bigger picture of the foreign-born population, we're talking about 1.2 million foreign-born, which are very much part of our workforce. More than 55% of them are naturalized citizens. Almost, 250 to 80,000 are green card holders. And the 250,000 with limbo status or undocumented or part of the mixed household families. And our members, MIRA has over 130 institutional members who have been in the front lines providing the support. And this federal help is crucial to our communities, it's crucial to our members, and it's crucial to the well-being of all our members of the Commonwealth. We talked about, inequalities going way back, and I just like to remind everyone that one of the massive barriers for foreign-born population green card holders started when IRA and PRORA passed in 1996, that created buckets of people who were not eligible to access any federal benefits. So the suffering goes way back. And having HEROES Act and extending the SNAP program has been extremely important to our families and to our communities. One thing I also wanted to say is that we need a lot more. There are 57,000 taxpayers in Massachusetts with limbo status, but taxpayers, contributors to our economy, and they were completely left out. They do not benefit from any of this. And there are many others who were in mixed status household families who were unable to access federal benefits. But I would say that we are also lucky to live in a state such as Massachusetts, when the governor led the way to create a resilient fund, all inclusive for the most vulnerable families with $19 million. That helped us to really push philanthropy to put more, and also helped our advocacy at the state level. As you know, the supplemental budget was signed a couple of weeks ago, and there is $10 million cash assistance for all families that MIRA was very involved in pushing hard and advocating for. So we are grateful for what has been done at the federal level, what you and your colleagues in Congress, Congresswoman, have done with the HEROES Act, what the state has done. But there is no philanthropy in the world, and there is no, stimulus in the world that continues to really address this issue. So we really need to go deeper and address the systemic problem, and then, come out with a long-term equitable and, agenda that everybody shouldn't talk about food. We live in the most powerful country in the world. And, it's time to address and attack this issue long-term. So next time we can talk about, as a country, what we have done to make sure that everybody has enough bread on the table.
Thank you, Ava. Carol?
Yeah, there's you may know her, a well-known pediatrician here in Boston named Debbie Frank. And Debbie has been active in trying to make sure that kids in particular get the food that they need. But when she talks about systems, she says, in the world of medicine, you need wellness care and you need an emergency room. And when you can't have one without the other. And so I completely agree with Ava that we have to get to the root causes of these problems, but we're always going to need a safety net. We're always going to need systems that can be enacted very, very quickly. The federal programs that we get that are particular to food banking is food out of USDA, and we would be in a world of hurt without the food that we get from USDA. But I will tell you, in the pandemic, there were now 7 programs, different programs that out of USDA for us to get food. Each one of them has different qualifications. Each one of them has different paperwork. Each one of them has different deadlines. And so it has made our work so much harder to be able to get the food to people in need. And what's interesting is, depending on what zone of the USDA you're in, the qualifications and the rules are applied in different ways. And as you can imagine, with us rule followers in New England, our rules seem to be much harsher. in terms of saying, well, you know, you're going to get audited, or we need to make sure that only people with 250% of poverty get food and nobody above that. But in terms of the sheer magnitude of food that we get from the federal programs, it's amazing. It's necessary because the food banks can't sustain this. The emergency system can't possibly sustain the levels that we have. And SNAP is an amazing program. WIC is an amazing program. HIP is an amazing program. And the more that we can do to take the stigma away from those. I mean, so many immigrants are not, who are entitled to be in these programs, are afraid of being in these programs. And I can't blame them at all, Eva. I mean, we've heard the horror stories. And we are lucky to be in Massachusetts. We are a much more progressive state. And I really wish that some folks on the other side of the aisle would take a look at the folks that have to stand in these lines or drive these cars or ask for help, because they're hardworking folks. They're people who are just trying to make it through the day. They are inspirational. They really are. And the only reason we keep doing what we're doing is because they keep fighting the fight.
23% of the frontline workers were immigrants, and all they're asking is access to policies, access and inclusiveness. And our state still hasn't passed a driver's license, a bill that will provide for anyone who drives and get to work and provide for their kids to be licensed and to be insured. So Massachusetts has done a lot. We're grateful for what we have, but there is still a lot more that needs to be done to really have an inclusive agenda that serves the well-being of everyone who resides here.
I agree. I totally agree. I feel that where a food bank is only a Band-Aid for the problem, similar to what Carol was saying, we're the emergency room, but there needs to be, we will not be able to keep producing at this level for quite some time. I mean, no emergency room, we have examples of it, could have so much ICU beds because that's not what it was made for. And programs such as what you mentioned, SNAP and WIC, which we are grateful for, but many people are afraid. There's a lot of misinformation out there. So a lot of immigrant families that we work in tangent with WIC here, and that's what they're hearing from people who come into their offices is that, well, WIC is a public charge rule, so they can't attend, and that's not true because WIC is not. Yeah. But there's so much misinformation that we need leadership from congressmen and from your colleagues to put that information that no, this is what this is what that is, because we truly believe, and I believe everyone in this work believe, that immigrants or people who are disadvantaged want to be empowered. Our job is to help them to be empowered and give them that pathway, not to be dependent. I'm from an immigrant family. I'm first generation. My parents worked very hard to provide for me. And I could say that they never were looking for a handout. They were looking for a hand up so they can be productive members of the society. And this is what these programs offer. And so we need to do a lot of advocating for these programs so they know that they're available. Because right now we're just handing them bags of food, non-discriminatory. We don't know if what dietary issues you may have. Here you go. I'm assuming that people would want to have some sort of dignity, some sort of independence to shop on their own and be independent. But there needs to be more on the in leadership to distinguish what's part of the public charge and what's not.
Yeah, and it's discouraging when we have Speaker Pelosi having to explain to Secretary Mnuchin what the WIC program is, but their campaign of fear has been a successful one, and it really is to great harm to families who are in need. But what makes me grateful and optimistic is the work that you all are doing in our communities. It's not new to any of you in this pandemic, but you have all risen to this moment and to really the suffering and the loss that is going on for so many families, whether it's lives lost, health threatened, hunger, and a loss of livelihood. And you're at the intersection of all these issues. And your work and your compassion and your advocacy are going to be crucial to the path forward. And I'm so grateful for you joining us here today, and so grateful for the work that you do. Thank each of you and the organizations and people you represent.
Well, thank you for the opportunity.
So much, Congresswoman, for doing this and highlighting this, because it is important.
Exactly.
Thank you so much for your leadership. And as you know, the House proceeds with another stimulus, please advocate that it's all inclusive and it provides for all the taxpayers and hardworking families.
That's right. We will.
Thank you.
Thank you all. Be well, everyone.
Thank
Stay
you
safe.
so much. Bye.